have here is a goniometer. Keep in mind that the goniometer actually is composed of three different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. Okay, we will be looking right now at tarsal inversion. And that movement would require the patient to turn their foot as though she was trying to look at the inside. So I'll ask her to turn. Okay, so that is the position. Okay, and relax. At this point, I will place the fulcrum using a different type of goniometer at the midpoint between the medial and the lateral malleoli. I'm going to line up our distal arm or our movable arm with the second metatarsal, and the stationary arm will be aligned with the anterior aspect of the tibia. So again, we're going to find the fulcrum and try to position her as close to neutral as possible, and then I will ask the patient to turn as though she's going to look under her foot, but I'm going to also ask her to try to keep her thigh as stable as possible. Okay, if you'll look. Good. And then I want to make sure everything's aligned. And I'm looking at the middle line here and here. At this point, I'm going to pinch the goniometer, ask the patient to relax. And in reading the numbers, because they're a little bit smaller, I want to find my light. And I'm going to say that she's at 35 degrees, and what we know is that she should be somewhere between 30 and 35. We will be measuring tarsal eversion. This will require that the patient will actually turn their foot outward as though she was looking at the side of her foot. So the motion looks like such. So you see that there's not a lot of motion there. Again, stabilizing by having her hip in a position by being in a seated position. This time what we're going to do is we're going to line up the goniometer so that the stationary arm is at the anterior aspect of the tibia, using the tibial tuberosity as a point of reference. We're going to find the fulcrum between the lateral and medial malleoli, and then we'll line the movable arm up with the second metatarsal. So here we are. And measuring. Okay, if you will look under the side of your foot for me. Measuring, again, I want to make sure that I'm in the right position. The tuberosity as being the point of reference, looking at the anterior tibial to line up the stationary, and then of course lining up the movable arm with the second metatarsal, and I pinch the goniometer and we get looks like 10 degrees of motion, and what we look for is anywhere from 15 to 20.